Your wait is over. The Medicare for the Lazy Man podcast is about to start. The Medicare podcast for blind people. And now, following breadcrumbs through the Medicare forest, Medicare expert Doug Jones.
Hello, ladies and gentlemen. Welcome to another exciting episode of the Medicare for the Lazy Man podcast. Thank you so much for joining us today. We're happy to have you. And the whole point of this podcast is to make people feel confident about the transition from Obamacare to Medicare. Most of the stuff we talk about is weird things going on in the world of Medicare, but I want you to be aware that I have written a book that will help you understand Medicare and help you understand it in such a complete way that you will know more about Medicare after reading my short little book than about 96% of the people in America understand Medicare right now. You will become an expert on Medicare. You'll be able to mystify and amaze your friends after reading my book. What is my book? Well, ironically, it's got the same name as the podcast, The Medicare for the Lazy Man 2022. It's on sale at Amazon.com. Put that into the search engine, Medicare for the Lazy Man 2022, and you're going to find it's got a whole bunch of different editions. It's got hardcover, it's got soft cover, it's got Kindle, ebook, and it's got an Audible, so you can listen to it at, when you can probably absorb all the Medicare knowledge that I impart in the Audible book by listening to it under your pillow while you're sleeping. But the important thing is that once you have the facts, once you have my recommendations, you can contact me to execute those recommendations so that when you are ready to enroll in Medicare, your coverages will be complete and everything will be done that needs to be done, and you'll be able to laugh at Medicare. You don't scare me. That's the whole point of my efforts here, and that's the whole reason that Randy Carson is here helping me do this. He is our podcast engineer. He keeps things sounding excellent when I would just flub it all. And I'm happy to have him across the screen, sitting in some sort of frigid environment. I don't even know where he is, but it's when I look out the windows behind him, it looks like a massive snowstorm has occurred. Randy, is that really a place that you want to be hanging your hat?
No.
Okay.
It reminds me of a place that I used to, when I was in the consulting business, I used to do a lot of consulting up in Minnesota. Minneapolis.
Yep.
And that reminds me of pulling into my hotel in Minneapolis.
Oh, boy.
There was many a day out there that we would get out in the morning to go to work. And all you could see in the parking lot of the Hilton, it wasn't the Hilton, it was a Marriott, was little humps of snow where all the cars were covered, but you could see little humps. So the only way you could find your car is to run around the parking lot, clicking on your clicker to see who answered you.
I had to do that once with my wife's car. I realized I couldn't find the car. I didn't know where she had left it in a big field next to the fairgrounds in St. Charles, Illinois. And so I realized that I could push the emergency alarm almost like a rape whistle, and it would respond. So that's how I found her car.
Yeah, that was my fond recollections of working up in Minneapolis during the wintertime was, you were talking a little bit on our previous episode about cold weather, and that, you said 26 below actual in Illinois, 27 below.
In St. Charles, Illinois on New Year's Eve, and I want to say 1980, 1981, maybe something like that. It was a nightmare, just a god-awful nightmare.
Well, we used to, now this isn't actual, because they always used to factor in the wind chill and all that good stuff for the wimpy people nowadays.
Yep.
So anyway, typically a morning in Minneapolis, getting up to go to work, it was between 42 and 46 below wind chill. and actual was probably about 20 something. But I would get up and I would trundle out there and start clicking my clicker to see if my car would answer. Yeah. And what was going through my head the whole time was, why am I here?
Yeah. Well, because you're a whore, people paid you money to be there.
Yes. Especially when my actual home at the time, as you know, was Cave Creek, Arizona.
Oh, boy, that was a bad choice of assignments. I would have maybe said, I put that one back in the envelope and say, give me another one, please.
Can I draw again, please?
Oh, boy. Oh, boy. Well, listen, I heard that you had another story related to Illinois, specifically the western suburbs of Chicago, and it involves radioactivity. Could you share a little of that with us?
Yes, I certainly can. I listen to a lot of YouTube stories and I do a lot of reading. And as Doug knows, my mind works in strange and wonderful ways. But I'm just a
emphasis on strange.
Yes, strange. Strange is very good. Yeah, it's a very good comment. But I love learning things and I love history and I just love bizarre little facts. Well, I was up late last night and I don't know just exactly what attracted me to this story, but it's a story about the Radium Girls. And for those of you who don't know it, back in the day, you could buy a watch. It was actually World War II was when it was very predominant, but you could buy a watch or you could buy an alarm clock or whatever have you that the hands glowed. Well, guess what that was?
I'm going to say it was green paint, innocuous, harmless green paint.
Well, you're right on one count. It was green, but it was actually paint constructed out of radium, which you might, for those of you who are scientists, might know that radium is radioactive. And the Radium Girls were high school kids. Well, they were just out of high school, most of them, that the Radium Corporation in Illinois hired right out of high school to paint the numbers on those clocks you all bought and your watches. And they were told, and the corporation knew full well that they were lying through their teeth, but the girls were told to always in between, painting a new dial to stick that brush in their mouth and twist it so you'd get a nice point. Well, over the course of time of doing that, they ingested a lot of radium. And they, again, were told by the corporation that, it's harmless, totally harmless. But ultimately, that turned out not to be the case, sadly. And the girls started getting sick to the point that, I won't tell you all the gory details, but their teeth started falling out. Basically their skeletal structure was just crumbling. And the reason I spotted this for Doug is that this was the first time in the history of the United States that a corporation was held responsible for medical damages to their staff. And I thought Doug would be interested in that.
Well, I'm very interested in that because this all occurred. When Randy started telling me the story off the air, I realized that this all had occurred in West Chicago, Illinois. And I remember back several decades ago when it was named as a Superfund site, the site of that factory, which had been torn down. They had to come back and dig up, like 5 feet of dirt all the way around the location of that factory because it was all radioactive, and they had to take it to a Superfund site somewhere, and God knows where it went. But Elgin, Illinois, not too far away from us, no more than 10 miles, was the site of the Elgin watch factory. And I'll bet a lot of those watch dials wound up being assembled into watches and clocks in Elgin, Illinois. And so this was like a whole radium neighborhood there, those 3 towns. But the thing I would ask is, how do we know for sure that it was common knowledge, or that it should have been known by the owners of the company that radium was harmful to people? Because if I recall correctly, the Curies, Marie and her husband, discovered radium.
Mm-hmm. Yes, they did.
Wound up dying from it because they didn't know how to protect themselves from the harmful radiation.
Right.
So it seems like there's a disconnect there between the discovery of radium and the discoverers dying of radiation poisoning.
Well, that's a good point. There is one loose connection there that I'll try to tie up for you. The person that invented this radium paint, and it was, what the heck was it called? It was like No Dark. That was the name of the paint.
Wow.
No Dark. He was a good chemist, but he wasn't all that creative in terms of names.
Not much of a marketer.
So anyway, this guy that invented No Dark was actually touring one of these factories. Could have been the one next door to you. Touring one of these factories, and he was watching all these girls, twisting that paintbrush in their mouth. And he went over to several of them and he says, "Don't do that."
Oh, really? So he knew.
He knew, and he ended up dying from it himself. But at that point in time, he knew it was very dangerous. He told them not to do it. And eventually, over the course of that day, the company kicked him out and told all the girls that he was just full of it.
Yeah. I bet the company didn't instruct them to do that with the paintbrushes. I bet they just figured it out themselves. Here's a shortcut. And here's a way to do our jobs faster because we're under a lot of pressure. And I bet their fault was really putting a lot of pressure on them to get a certain amount of work done in a certain amount of time. They
had to paint 250 dials a day.
Well, there you go. Once again, my genius shines through.
And the ultimate price, other than paying for with their life, the ultimate income they made for each dial was a penny and a half.
Really? Okay, piecework then.
Piecework. Yeah.
Wow.
And that was the situation with the Radium Girls. And the sad ending to that story is that for those of you who are not chemists, the half-life of radium is 1,600 years.
Oh, I thought you were going to say 16 years, and it's all the danger's gone now.
1,600 years, so that after the fact, you might guess that all these women that died are still radioactive. It accumulates in your skeletal structure, and they had to go back around and dig them all up and put them in lead-lined coffins.
Oh boy, that's a sad story. It's there was a lot of ignorance about the effect of radiation back then. I'm going to tell one little short story before I launch into the Medicare content for this podcast episode. But you may recall, you and I had some fun discussing tonsillectomies.
Yes.
In the past. And I had a lot of fun listening to Bill Cosby's album where he talks about the tonsillectomy that he had when he was a little kid and how the other little kids in the hospital ward were so excited because they found out they could have all the ice cream in the world they could eat after the operation. And then it turned out that the ice cream, which they dearly coveted, was so painful to eat that they did not enjoy it at all. And that was the end of his very lengthy tonsillectomy hunk, as it were. But I never had my tonsils out because I was treated by a very far-sighted doctor, a pediatrician on the North Shore of Chicago. My family, I somehow got tapped into this guy, and they took me for treatment there with his method of avoiding the need for a tonsillectomy. And that was to shoot my throat all full of radiation. And it worked like a champ. I never needed a tonsillectomy. I have my adenoids. Everything is just fine. All my friends had tonsillectomies, and they didn't have this fantastic doctor. On the other hand, when I was about 55 years old, I woke up one morning and my doctor said, "Your blood test results show that your thyroid has quit working."
Gee, I wonder why.
And it's going to kill you if we don't get it out of there. So there was an unintended consequence for this pediatrician's shooting my throat full of radiation, and it was my thyroid that became the victim of it. So I am thyroidless now. But
you don't glow in the dark.
I don't glow in the dark, and I still have my tonsils. So there. Bleh.
There you go. There you go. Well, that's I love that story. And to your point, nobody knew what they were doing with it. Yeah. They were actually selling irradiated water. I mean, they were trying to tell you it was good for your health.
And you remember talking about the shoe stores having a radiation way of seeing your bones in your new shoes to make sure they fit properly.
Oh yeah. Yeah. I can see your toes as they're melting now.
How many mothers told their kids to go stand on the machine and stick your toes in the holes?
No, I know. We need to see if your toes are hitting the front of the chute. Well, you don't need to worry about it because they'll rot off shortly.
Dealing with in the past that I thought might be of interest to the listening public, especially those that are interested in Medicare. One is an article that doesn't really have a headline. It says abstract at the top, but I think it's an abstract of a longer article, and I couldn't find the long one. Maybe that's a blessing for the listening audience, but this is an indicator that Medicare, I'll just read it to you. Medicare beneficiaries in rural areas may face challenges to gaining access to care, particularly if enrolled in Medicare Advantage plans. With these barriers to care may in turn increase switching to traditional Medicare, fee-for-service, they call it. So if you start out because somebody like, let's say Joe Namath or Jimmy J.J. Walker convinced you to purchase a Medicare Advantage plan because it has all kinds of free stuff, even though we know that unless you're destitute, the free stuff is not going to be a part of your plan. And if you live in a rural area, you're going to find many times that the doctors, hospitals, the other providers, the dentists in their little network are going to be so far away from you that it won't be convenient for you to seek medical treatment and have it paid for by your Medicare Advantage plan. So in rural areas, switching from Medicare Advantage to traditional Medicare is very common, something on the order of 10.5%, compared with city folk who switch from the inferior Medicare Advantage plans to regular Medicare, and that's about 5%. So 10.5% switch in rural areas. In city areas and civilization, then it's a smaller amount, but still many people switch from Medicare Advantage to regular Medicare with a Medicare supplement. The differential was even greater among rural enrollees who were high cost or high need. Of 11 care satisfaction variables we examined, dissatisfaction with care access, meaning you can't get to where you need to have the care provided, had the strongest association with switching from Medicare Advantage to regular Medicare among rural enrollees. Our findings point to the importance of developing policies targeted at improving care for access for rural Medicare enrollees, Medicare Advantage enrollees, that is. Well, I say that the solution is to provide them with Medicare supplement plans because those work everywhere. You don't have to go to a different town to find a doctor in the skimpy network of the Medicare Advantage plan you might have been talked into signing up for. So that's just a little indicator that Doug is right. Medicare Advantage is often very disappointing to people. Here's the other article I ran across that I thought was moderately interesting. Types of healthcare associated infections. These are infections people get after they've been treated by doctors, often surgical procedures. And so the whole thing starts with modern healthcare employs many types of invasive devices and procedures to treat patients to help them recover. Infections can be associated with the devices used in medical procedures such as catheters or ventilators. These healthcare associated infections, they even have an acronym for them, HAIS, healthcare associated infections. They include central line associated bloodstream infections, catheter associated urinary tract infections, ventilator associated pneumonia, and infections may also occur at surgery sites known as surgical site infections. The CDC, this is the department of the federal government that tries to force people to wear masks while they sleep, while they ride on airplanes and other places that masks don't do any good. The CDC works to monitor and prevent these infections because they're an important threat to patient safety. So they have the central line associated bloodstream infections, catheter associated urinary tract, surgical site infections, and ventilator associated pneumonia. So what is a surgical site infection? It's an infection that occurs after surgery on a part of the body where the surgery took place. Surgical site infections can sometimes be superficial infections involving the skin only. Other surgical site infections are more serious and can involve tissues under the skin, organs, or implanted material. Symptoms include redness and pain around the area where you had surgery, drainage of cloudy fluid from your surgical wound, and fever. Can surgical site infections be treated? Yes, most SSIs can be treated with antibiotics. The type of antibiotic given depends on the bacteria, the germs causing the infection. Sometimes patients with SSIs also need another surgery to treat the infection. What are some of the things that hospitals are doing to prevent these things? They should follow CDC infection prevention guidelines, including cleaning their hands and arms up to the elbows with antiseptic agents just before surgery. Clean their hands with soap and water or an alcohol-based hand rub before and after caring for each patient. If indicated, remove some of your hair immediately before your surgery using electric clippers if the hair is in the same area where the procedure will occur. Wear special hair covers, masks, gowns, and gloves during surgery to keep the surgery area clean. Why would you wear a mask during surgery? Why would a doctor wear a mask? So that he doesn't spit into the wound, the surgical area. A lot of people say, well, everybody should wear a mask so that we don't spread COVID to anybody. But that's a load of garbage. The surgeons, when they're performing surgery, wear masks to avoid spitting and the consequent infection that comes from the germs from their mouth. They don't want to spit or have saliva wind up in the patient's scar or surgical area. When indicated, give you antibiotics before your surgery starts. In most cases, you should get antibiotics within 60 minutes before the surgery starts, and the antibiotics should be stopped within 24 hours after surgery. Clean the skin at the site of your surgery with a special soap that kills germs. These are all the things that doctors and nurses should do to help you prevent surgical site infections. And then the next question is, what can I do to prevent surgical site infections? Well, before surgery, tell your doctor about other medical problems you may have. Health problems such as allergies, diabetes, and obesity could affect your surgery and your treatment. I think the doctor could probably tell the obesity part, but diabetes and allergies, doctors should know about that. Quit smoking. Patients who smoke get more infections. Talk to your doctor about how you can quit before your surgery. Do not shave near where you will have surgery. Shaving with a razor can irritate your skin and make it easier to develop an infection. At the time of surgery, speak up if someone tries to shave you with a razor before surgery. Ask why you need to be shaved and talk with your surgeon if you have any concerns. After surgery, if you do not see your providers clean their hands, please ask them to do so. I don't know about you, but I'm going to be unconscious after surgery. My plan is not to be awake at any time before, during, or after the surgery. Family and friends who visit you should not touch the surgical wound or dressing. Okay, that's always a good rule of thumb. Don't touch the surgical wound if you go to visit somebody. Family and friends should clean their hands with soap and water or an alcohol-based rub before and after visiting you. If you do not see them clean their hands, ask them to clean their hands. Make sure you understand how to care for your wound before you leave the hospital. Always clean your hands before and after caring for your wound. Make sure you know who to contact if you have questions or problems after you get home. If you have any symptoms of an infection, such as redness or pain at the surgery site, drainage, or fever, call your doctor immediately. Okay, well, surgical site infections, just one more thing to worry about if they haul us off to the hospital, Randy. Not happy about that.
The last time I was in for the, not for the COVID stay, but I had a stay before that involved some surgery. And they wanted to get, now, obviously I knew why they wanted to do this, but as is often said, hospitals are no place for a sick guy.
Yeah.
So they actually, this is the first time that I remember them ever telling me, we need to get you out of here and we need to get you out of here as quick as we can, because the alternative thing they could have said is, if the longer you stay in here, the larger the risk is you're going to catch something you don't want.
Well, I think that's a very rational opinion or attitude on the part of these guys. And the fact that they want to throw you out, often that's a decision based in economics. In other words, hospitals can be penalized if they dilly-dally and keep patients too long. But in your case, they were very pragmatic about the possibility of infection complicating whatever your problem was.
Yep. And then on a rare occasion, there was a Medicare Disadvantage guy would pop his head in and say, "Are you feeling depressed?"
Well, do you remember the article warned you if you have visitors, don't let them touch your wound?
Yeah.
Did the Medicare Advantage salesman try to touch your wound?
Don't touch that. Oh my God. That is so painful looking. Don't touch it.
Oh, just once. Let me touch it once.
Come on. Let me just poke it once. Okay. Yeah, it was an interesting stay, believe me. And I had never been in the hospital before. So it was interesting all the way around. So anyway, we're out of time.
Oh boy, that happens too often, doesn't it?
And you've already talked about the things that people need to do when they sign off of the podcast as related to your book and your audios and the electronic version on the Kindle. So we've got that all covered. But we have one more thing that I'm going to lay out there as a hanging chad for next time. And that is the term, we're going to talk about gaslighting. So we're going to talk about that next time.
Okay, well, that sounds exciting. I enjoyed hearing about the Radium Girls.
Radium Girls, yeah.
It's too bad that it was always girls, but that's who did piecework, factory work back in the day.
And the interesting part, I mentioned that they were getting paid 1.5 cents per dial.
Yeah.
And believe it or not, well, that was the highest paying job available for piecework for young women at that time.
Boy, well, too bad that it had to end in such a disastrous and sad fashion. But, that's a lot of things are very dangerous that we don't think about. Farming, I guess, is one of the most dangerous occupations that people can have. And you should know better than most people because you spent some time in rural Nebraska.
150 ways on a farm you can get yourself killed or severely damaged.
And not all of that comes from irritating the livestock, I would imagine.
No, most of it's equipment related. But the only thing I know of that's more highly ranked in terms of danger as a career is lobster fishing.
Really?
Yeah.
Well, why would lobster fishing be inherently dangerous? I know they have TV shows about it, so it's got to be hard lifestyle. But
those lobster pots that they're constantly swinging around on the deck on cables.
Okay. Let's assume that I know them.
They weigh about 350 pounds a piece. And you can get yourself knocked overboard by being in the way of one of those things, or just pretty much just broken in half if they hit you, because obviously the ship is rolling and pitching all the time.
Yeah. Well, I think another dangerous occupation having to do with the ocean is being in the Russian Navy in any capacity.
Yes. Yes, it absolutely is. Absolutely. That's a bad idea.
Yeah. Well, that's a subject for a whole nother podcast. So
this is just a training exercise, guys. Don't worry about it.
Thanks for holding the door open while we exit the podcast studio.
Yeah, exactly. So anyway, thank you for joining us. We always enjoy having you with us. Without you, it wouldn't be nearly as much fun as it is. And we do have fun some days, as you can tell. Without that, I don't know. Would we continue to do it? Yeah, probably.
I would. Yeah. What else are we going to do?
We have way too much fun. And Doug told me earlier in the podcast that he's getting his GTO all revved up so we can do. Last year, you might remember that we did a podcast episode in my driveway, drinking an adult beverage.
It was on St. Patrick's Day, as I recall.
Yes,
very close to it.
Yes, it was. Absolutely. So anyway, thanks for joining us. I'm going to sign us off now because we're out of gas and we're floating into the dock. So we definitely need to sign it off. But thank you for joining us. We have just spent about 32 and a half minutes with Doug Jones, the insurance guy from Oklahoma, and now taking up residence in his Fortress of Solitude in Cave Creek, Arizona, is Doug Jones. expert in Medicare.
Bye-bye.